Everything you need to know about diclofenac: uses, dosage, and side effects. Hey everyone, are you dealing with pain, inflammation or fever and looking for a solution? Well, you've come to the right place. In this video, we're going to dive into the world of diclofenac, also known as Voltaren. This powerful medication is used to alleviate pain associated with conditions like osteoarthritis, rheumatoid arthritis and more. Not only that, but it's also used to reduce fever caused by the common cold or flu. We'll be discussing everything from uses and dosage to potential side effects, so make sure to stick around until the end. So, get ready to say goodbye to pain and inflammation and hello to relief. Let's get started. Diclofenac, also known by its brand name Voltaren, is a nonsteroidal anti-inflammatory drug, NSAID, commonly used to relieve pain, reduce inflammation, and lower fever. It is available in both prescription and over-the-counter forms, and can be taken orally, applied topically, or given as an injection. One of the most common uses of diclofenac is to alleviate pain associated with conditions such as osteoarthritis, rheumatoid arthritis, and ankylosing spondylitis. It can also be used to relieve menstrual pain, headache, and toothache. In addition, diclofenac is sometimes used to reduce fever caused by the common cold or flu. When taken orally, diclofenac typically starts working within 30 minutes to an hour, with the effects lasting for around 4 to 6 hours. The recommended adult dosage for oral diclofenac is 50 to 75 mg twice daily, or 25 mg 4 times a day. However, the exact dosage will depend on the condition being treated and the individual's response to the medication. Topical diclofenac, which is available as a gel, cream, or patch, is applied directly to the skin to relieve pain and inflammation in specific areas of the body. It is typically used to treat conditions such as sprains, strains, and tendinitis. It's important to note that like other NSAIDs, diclofenac can have side effects. The most common side effects include stomach pain, heartburn, nausea, and diarrhea. In rare cases, diclofenac may cause more serious side effects such as bleeding or ulcers in the stomach or intestines and high blood pressure. It's important to talk to your doctor or pharmacist about your medical history and any other medications you are taking before starting diclofenac. In conclusion, diclofenac is a widely used medication for pain relief and inflammation reduction, but it's important to be aware of potential side effects and to consult your doctor or pharmacist before taking it. As always, it is important to follow the recommended dosage and to not take the medication for longer than recommended without consulting your doctor.